I'm Dr. Collins, and in this clinical examination video, we're going to look at Schober's test, a special test used to assess lumbar spine flexion. Schober's test helps determine whether there is reduced movement of the lumbar spine, which typically occurs in inflammatory conditions such as ankylosing spondylitis. Before we demonstrate the technique, let's quickly recap the anatomy. The lumbar spine is made up of 5 vertebrae, L1 to L5, which provides flexibility while supporting much of the body's weight. When we bend forwards, the lumbar vertebrae flex, causing the distance over the lower back to increase. Schober's test simply measures this increase. If the distance expands less than expected when the patient flexes, this can suggest that there is reduced lumbar spine mobility, or in other words, stiffness. In order to perform the test, ask the patient to stand comfortably with their feet shoulder width apart. Identify the posterior superior iliac spines by palpating the dimples of Venus. Put your first mark in the middle of these landmarks. This point approximately corresponds to the level of the S2 vertebra. From this point, measure 10 centimeters upwards along the midline of the spine and make a second mark. Then we'll go ahead and measure 5 centimeters below our original mark and make our third and final mark. Notice now how we have a total of 15 centimeters between the second top and the third bottom mark. Now we will ask the patient to please bend forwards as far as possible, as though they're trying to reach their toes. It is important that they don't bend their knees. Once they have reached their maximal forward flexion, we will remeasure this new distance between the top and the bottom marks. A normal result would be that the distance between the top and the bottom mark increases by 5 centimeters or more. In other words, the total between the bottom and the top marks should increase from the original 15 to at least 20 centimeters or more. An increase of less than 5 centimeters suggests reduced lumbar spine mobility and constitutes a positive Schober's test. Before we close, here's a quick note on the clinical value of Schober's test. Schober's test has moderate sensitivity up to around 80%, meaning it can identify many patients with reduced lumbar spine mobility. However, it has relatively low specificity at around 42%, meaning an abnormal result can also occur in people without significant spinal pathology. In practical terms, Schober's test should be used as an adjunct rather than a standalone diagnostic test. For example, it can support your assessment when evaluating a patient with chronic back pain in whom you are considering an inflammatory cause and a rheumatology referral. Schober's test results should always be interpreted alongside the history, the rest of the musculoskeletal examination, and appropriate investigations such as HLA-B27 testing, inflammatory markers, and imaging where indicated. Schober's test can also be a valuable tool for monitoring disease progression or response to treatment, particularly in patients with inflammatory spinal conditions such as ankylosing spondylitis, where serial measurements of the lumbar spine mobility can be compared over time. Thanks for watching. If you like this video, please like and subscribe to fuel the passion to create more videos. And don't forget to check out our other clinical videos on our channel. Good luck!